Kansas City native Amanda Quick was 29 and living her dream life in New York City when, in the spring of 2021, she found something.
I felt under my left armpit just a swollen lymph node lump.
She says she dismissed it until a few months later when it had grown larger and harder.
They had me get a sonogram, a mammogram, a biopsy.
The diagnosis, metastatic breast cancer, or stage 4, meaning the cancer had already spread to other parts of her body. You get a stage 4 metastatic breast cancer diagnosis. I cannot even imagine how you process that.
For some time, I definitely didn't. I was definitely in denial.
Get screened, head down to the bottom floor.
She started on hormone therapy, including a targeted drug and monthly injections.
The days that I go into treatment, those are the hardest. I think everything just always comes back.
I have stage 4 breast cancer.
The American Cancer Society estimates that of the women diagnosed with breast cancer each year, 6% are at stage 4. In 2016, while 36-year-old new mom Ann Keene was working out,
I had noticed some pain along my sternum.
She says she thought she was just out of shape, but the pain persisted. A week later, she noticed some dimpling in her breast.
It was metastatic breast cancer. It had already spread to my bones. That was the pain that I was feeling in my sternum. It was in my lymph nodes and also in my liver.
She started chemotherapy, and the medication sent her into early menopause.
I had no inclination that this was even possible, to have stage 4 breast cancer at such a young age.
Stage 4 cancer is usually considered incurable. Treatment is typically focused on preventing the spread of cancer cells, treating symptoms, and improving quality of life.
It's not just about survival and numbers and months and years, which are of course incredibly important, but also thinking about how we are living our days.
New research is vital to moving the needle on outcomes for patients.
About 55% of patients with metastatic breast cancer have a relatively new type of classification of that breast cancer called HER2 low metastatic breast cancer. And there's a new treatment called T-DXd or Enhertu that is improving the survival of these women.
Results from the clinical trial showed the targeted treatment slowed the spread of the cancer and improved survival rates by 35% for those with HER2 low metastatic breast cancer. And new technology is looking to use blood tests to change the way cancer cells are diagnosed and tracked. 6 years after her diagnosis, Anne, now 42, is hoping to inspire others.
I really thought I wouldn't see my kid go to kindergarten. And now I wake up in the morning, I work out, I'm working full time. I can go pick up my daughter from school. It's really beautiful.
And now she's training to run the Boston Marathon again in 2023 to raise money for research. Amanda is also using her diagnosis to reach others. What have you learned most through your journey so far?
Every day is a gift. If there's one person that can say, hey, I saw your experience, I saw your story, and you've helped me get through today, then that's amazing.
Amy Robach reporting. We hope those women stay strong.